please.
Chairman Zerwas and members of the committee, it's a privilege for me to speak with you today on behalf of the Texas Medical Association, the Texas Pediatric Society, and the Texas Academy of Family Physicians, which represent nearly 40,000 physicians and medical students in the state. I'm Dr. Philip Huang. I'm a family physician and the health authority and medical director for the city of Austin. I also formerly was the medical director for the chronic disease prevention at the Texas Department of State Health Services. I'm submitting written testimony that covers chronic disease prevention, emergency preparedness, and infectious disease prevention, but in my 3 minutes I'll just highlight a few of the points. First, with respect to chronic disease prevention, the chronic conditions such as diabetes, cancer, heart disease, and stroke are among the most prevalent, costly, and preventable of all health problems. Together, they account for 3 out of 4 deaths in our state each year. From an economic standpoint, they're accounting for about 75% of U.S. health care costs. So it's extremely concerning to us that the proposed reductions for community chronic disease programming are on the plate. Specifically, I'd like to talk about tobacco prevention. As you're probably aware, tobacco use remains the single #1 preventable cause of death and disability in our state and in our community. This year, another 24,000 Texans will die prematurely because of tobacco use. That's more than AIDS, crack, heroin, cocaine, alcohol, car accidents, fire, murder, and suicide combined, and it's entirely preventable. Also, economic cost-wise, it's estimated over $20.4 billion each year that the state is having to pay regarding tobacco use. Earlier, actually, one other thing, currently the price of a pack of cigarettes is about a little over $5.50 or so. If you take all those costs to the state and apply it for each pack of cigarettes, it's costing the state about $21 per pack for all those other costs. Now, again, there was discussions earlier about the tobacco settlement, and I was personally involved with working on that tobacco settlement when I worked with the state in the late 1980s. And many people forget that that it was a $17.3 billion settlement that the state is still receiving funding for, in addition to the $200 million tobacco trust fund. So I think the state's getting another $500 million in new funds each year. So I think it's actually unconscionable that this current budget has $0 for tobacco, given that the state won that $17.3 billion settlement, and it was entirely for the cost of tobacco use that the state was paying with Medicaid costs. So, if those cuts are made, it will have dramatic impact on our state tobacco quit line, which we at the community levels are certainly taking advantage of. It's a free service for all citizens of the state to get access to evidence-based cessation. Also, I think the legislature can actually expect some financial benefits in addition to public health benefits if you implement the statewide smoking bans, such as House Bill 670 by Representative Crownover, which would eliminate smoke in indoor workplaces and also reduce the impact of secondhand smoke on Medicaid patients and insured state employees and other publicly insured personnel. So you were talking about the effect on low birth weight. These are some of the key interventions that can have an effect on it. But in closing, I ask you to protect funding for many of these critical public health programs. In a budget crisis, it makes even more sense that we invest in these effective cost and life-saving programs, and our organizations are here and ready to help you in the next few months.